Guardant Health AMEA is making a giant leap in supporting cancer detection and treatment. Early last month, its Guardant 360 CDx liquid biopsy received approval from the US Food and Drug Administration, and that can help identify the genetic signature of tumours. The information can then be used to match patients to treatments or research trials, significantly shortening the process that could sometimes take months. The company, a joint venture between Nasdaq-listed Guardant Health and Japan's SoftBank, also aims to make the tests available to 50 countries by the end of 2022 and quadruple revenue by then. Let's talk more about this, and I'm very pleased to say that Simranjit Singh, CEO of Guardant Health AMEA, is joining us now. Simranjit, thank you very much indeed for your time today. Now, many hospitals have shifted COVID testing and may not have all the resources to undertake genomic profiling required for cancer patients. Just talk us through how Guardant is addressing this and how new technologies like liquid biopsies help.
Sure. I mean, I think the pandemic has been an unprecedented crisis for the healthcare systems globally. And in Asia, Middle East, and Africa, this has been a very pertinent issue. For us, we've been able to work very closely with oncologists to make sure and ensure that the patients get adequate care. We know that pandemic or not, cancer is not going to go away, and patients need to be treated for their cancers. So one thing that we did was that we knew that in terms of liquid biopsy, you did not need to be able to be hospitalized for any interventional procedure. You only need to have a simple blood draw done. It can be done in an outpatient clinic. It could be done even in the comfort of the patient's home. So we started mobile phlebotomy services to be able to ensure that patients were not going to be undiagnosed during this tough period as well.
Give us a sense of how you begin what must be a very difficult task, Simranjit, of pricing these tests and these treatments, because healthcare and big pharma, it's often been criticised for being part of the problem and not pricing treatment and medicine affordably. Can there ever be affordable cancer care treatment?
I mean, I think it's always important to look at the full value. And what advanced diagnostics brings to the table is to be able to provide appropriate therapy selection for the patient. So in that way, you have the most effective treatment for the patient. It also eliminates waste for treatments that might not work very well for the patient. So in that way, you are actually providing greater value for that patient and hence increasing affordability. The other important factor is to look at the burden of cancer. I mean, if you look at our region of Asia, Middle East, and Africa, we have close to more than 50% of the incidence of cancer, but more than 70% of the mortality of cancer. So how do you bend the cost curve and the mortality curve? So you need to be able to diagnose and to be able to detect the right genomic mutation so that the appropriate therapies can be given to the patient.
Simranjit, you got the world's first FDA approval for this liquid biopsy technology. Could you give us the non-doctor, the layman, if you like, view on what exactly liquid biopsy is and how significant it was getting this FDA approval for you?
Yes, no, thank you, Rosanna. I mean, I think it's been a milestone for the company. We were the first liquid biopsy to get FDA approval, as you have noted. So in simple terms, I mean, I think tumor as it progresses, solid tumors as it progresses, they shed DNA signatures or they shed DNA material into the bloodstream. Maybe 10, 15 years ago, it's probably it seems like science fiction that you can detect these small molecules or small DNA fragments, but you can do them now. They are like close to about 5 nanograms to 30 nanograms of DNA material, which we detect, and we are able to then identify the mutations that are driving that particular cancer. And at the crux of all cancers, it is a genomic disease. So as you detect these mutations, you are then able to prescribe, or the doctor is then able to prescribe appropriate, more effective therapy for that particular patient. I tend to describe it as a GPS for detecting cancer or detecting mutations that are driving the cancer.
A GPS for detecting cancer. I'll remember that one for sure. Now, look, you've got ambitious plans for your business in the coming years or so. You're looking to increase the availability of testing to 50 countries and quadrupling revenue by the end of 2022. My question there being, is the pandemic not going to stifle some of that growth? And also, you're looking at opening your first lab outside the US in Japan. Why Japan?
Yeah, so I mean, I think overall the pandemic situation obviously has caused major markets to obviously slow down as well. Access of patients to care has also been impeded. However, I mean, I think when it comes to cancer, everybody recognizes that especially in advanced cancer, time to treatment is absolutely necessary. And that's where liquid biopsy becomes really important. We are able to have a turnaround time of 7 days. So for a patient, you can start treatment. Once you get the results, you understand which are the mutations that are driving your cancer, and appropriate therapy can be given within 7 days. So hence, we've seen that during the pandemic, because of the fact that interventional procedures or traditional tissue biopsies become very difficult to schedule and do, liquid biopsies has taken a greater importance. With the FDA approval, it has actually accelerated our adoption as well. You mentioned about Japan. I think in Japan, one of the major factors that has driven our presence in Japan and our growth in Japan has been the governmental push towards using new technologies like next generation sequencing, looking at genomic analysis. They were able to now create a reimbursement structure for that. And so that's also helping us to look at building our first lab in Japan.
Simranjit, just on the issue of technology and advanced diagnostics, telemedicine, to what degree is this a step change in how we treat cancer patients in a COVID era, and what are its limitations?
Yeah, so I mean, I think the good thing about telemedicine is that it helps to prevent the visits to the hospital, unnecessary visits to the hospital, and so that limits the chances for cross infections to occur. The limitations to telemedicine is that yes, you can do a consultation, but it's very difficult to do your blood tests, your other routine tests, your CT scanning. All of that will require you to come into the hospital to be able to have those procedures done. The other part of it is that if you're going to be looking at changing of medication, you're looking at education of new medication, that also becomes a little bit more difficult with telemedicine. However, I think as we are moving forward and there's more adoption of telemedicine, we are seeing that education as well as greater engagement with patients to understand their quality of outcomes from the treatments that they're getting, that can be done via telemedicine.
Simranjit, we're very grateful for your time today. Thank you very much indeed for bringing us up to speed with these developments and the new technology that you're bringing to the table in the fight against cancer. Simranjit Singh there, CEO of Guardant Health, AMEA.